Well, it's certainly no secret smoking is bad for us, but despite the facts, 123 Canadians die every day from tobacco-related illness. A huge number of those people were also living with mental illness, as A News reporter Louise Hartland shows us. One nurse is trying to help by offering a smoking cessation program for people in the mental health care system.
Okay, so this is the room where you...
Yes, absolutely.
For 1 hour every week, Joan O'Connor turns from a registered nurse to a tobacco treatment specialist at the Eric Martin Pavilion. O'Connor works with people in the mental health system at the Psychiatric Day Hospital who are trying to quit smoking.
Because motivation is so difficult and so important, we get together and everybody reports how many cigarettes they haven't smoked that week, how much money they have therefore saved, and we all cheerlead each other.
Every Wednesday afternoon, the group, the Tobacco Fighters and Survivors Club, meets for a good reason.
People living with mental illness smoke at a much, much higher rate than the general population.
For example, studies show 80% of people with schizophrenia smoke, 70% of bipolar patients smoke, and more than 50% of people with depression are addicted to cigarettes. Because of that, people with a mental illness die 25 years earlier than most, from illnesses such as cancer, emphysema, and heart disease.
Their early deaths are attributed almost completely to this extra smoking behavior. So it's a vitally important issue for people living with mental illness.
That is why O'Connor, a former smoker herself, is trying to teach her clients to drop the habit.
I try and teach people about the process of addiction and how to use the medications that are available to deal with their addiction, and how important social support is.
Another big part of the process, teaching clients how tobacco companies market themselves. O'Connor says some group members feel targeted and use their frustration as fuel for another outlet.
Oh man, I smoke.
This is a play written, acted, and put together by people in the Tobacco Club about their experiences and relationship with cigarettes. The project was directed by a UVic student as her master's thesis in theater.
One of the clients said that it made him feel more normal and he feels more confident. And just to be able to help somebody else develop those skills is so wonderful.
O'Connor says even with a lack of resources, the program is working for the people in the club.
The main measure of success right now is the 527,000 cigarettes not smoked since January 2008.
A success O'Connor hopes will continue to give the people in her club a chance at a healthier and longer life.
Louise Hartland joins us now. Louise, how many people are involved in the Tobacco Club?
Eric, there are usually about 20 people who attend the weekly meetings. Organizers say the program could help many more patients if it had the funding to do so. People in the mental health field are hoping events such as the Courtnall Celebrity Classic will raise money for much-needed programs such as the Tobacco Fighters and Survivors Club.
And the Courtnall Celebrity Classic is coming up pretty soon.
Yes, it is. The gala dinner is Friday, July 22nd at the Empress Hotel, followed by a golf tournament at the Victoria Golf Club on the 23rd. For more information on participating or donating, visit the website courtnallclassic.org. Eric?
Louise Hartland reporting. Thank you, Louise.